Hi everyone, we're gonna start our webinar now. Just to introduce the space a little bit, the space is focused on just overall wellness, but in particular this panel for this month, we wanted to focus on mental health and just talking about mental health from the perspective of marginalized students, because we oftentimes we know that marginalized students don't get this access, or it's a bit more difficult for them to have access to mental health and mental health resources. So we're trying to fill that gap. So I guess to start this panel, we'll introduce ourselves. First, I guess the team behind the panel, and then our wonderful panelists who are here today. So to start off, my name is Natalie Zamora. I use she, her, hers pronouns. I'm a second-year public health major with a minor in child development, and I am an intern at the MCC.
Hi everyone, my name is Michelle Alexander. I'm a fourth-year psychology major, child development minor as well. I use she, her pronouns, and I'm also an intern at the MCC. And we're really looking forward to this conversation. So thank you all for being here.
Hi everyone, my name is Alexis and I am studying environmental sciences as a graduate student, and I'm the graduate assistant at the Multicultural Center.
And hi, my name is Andrea Gutierrez. I use she, her pronouns. I'm a second-year business admin student, and I'm a student lead for the Dream Center. I'm very excited for this collab. Thank you all for being here.
And then the panelists, whoever wants to go first, can introduce themselves.
So if you would be able to go ahead and introduce your name, pronouns, what you tell us a little bit about your work in the field of mental health, and also why this work is important to you.
Well, I'll go ahead and get us started. I'm Dr. J Garcia. I use they, them pronouns. I'm an assistant professor in psychology and child development. I'm a Cal Poly alum, so I did my undergrad at Cal Poly before going off to do all my other schooling and then coming back. I'm also a licensed psychologist, and so I see clients in the community. And so, yeah, I juggle kind of my professor world and then my world of seeing clients. I also teach in our master's program for psychology, which is a marriage and family therapy program. So I train a lot of our therapists about how to be good therapists. And so yeah, that's a little bit about me and my background and why it's important to me. I mean, it's my field. It's what I do. It's my bread and butter. It's something that has seeking mental health and support has helped my journey through college and grad school and, across a number of years. And so it's affected me personally and obviously now professionally. It's everything I do. So yeah, thanks for having me.
I can go next here. My name is Andrea Lawson. I use she, her pronouns, and I am new to Cal Poly as the Director of Counseling Services. And this is my first student panel or panel at all, and I'm super happy that this is where I get to start, is talking with you all and being on a panel with the other panelists here, because this is really a key part of who I am as both a social worker and as a director and as a therapist, is making spaces where everybody can show up and feel belonging and connection and have access to the care that they need. So I hold a lot of privileged identities. I identify as white and straight and cisgender, and all of those things give me access and voice in places that I am really mindful of how to create other spaces where other voices can be heard and where I can empower and amplify the voices of those around me who need to be centered and connected. I think a lot of times when we think about mental health and access, we think about the majority, how can most people get in? And I really think we need to be looking on the edges and on the spaces where there is a lack of trust for very good reason, or maybe sometimes just for lack of access or lack of resources. And how can we shift that to maybe going outside of our typical bounds or our typical spaces to build relationships, to create belonging, and to build those bridges so that students can be successful here at Cal Poly and in their lives after college as well. So thank you for having me here. I'm looking forward to the rest of this discussion.
Hi, I'm Malia. My pronouns are she, they, hers, theirs. I am a Cal Poly alumni. I graduated in the spring of 2020 with a BA in English. So I don't work in like psychology or counseling, but I was an RA for the past 3 years that I had at Cal Poly. And I also worked for the Multicultural Center. So I saw and worked with a lot of students who were affected by different mental health crises or just struggles with mental health. And I feel like during my time at Cal Poly, it was right when Cal Poly was starting to prioritize BIPOC students like mental health and starting to create programs. Much like this is probably the first panel I've ever seen where we really are starting to address students of color's experiences with mental health and everything. So that's where I'm coming from with experiences with students directly. And then just talking with students now, I work as like a freelance writer and work with students on like writing emails, especially first gen students, and where the anxiety comes from and all of that in terms of working with being a student and all of that. Yeah, really excited to be here.
I can go ahead and go next. Hello, it's wonderful to be here. My name is Katie Miller. I use she, her pronouns. I am a fourth year psychology major at Cal Poly. I'm minoring in biology and philosophy. I currently am an intern with Pulse, a peer educator working with the REAL team, which is the mental health team at Pulse. Previously, I worked as an RA for a year and a half because of coronavirus. And then what else? I worked as a behavior interventionist for about a year, working with young children with autism and ADHD. As far as why it's important to me, my whole life has been affected by my journey with mental health. Really like starting with a tough loss of a friend to suicide when I was young, really kind of got me on this path and got me really interested in, preventing that in other people and helping people, amplify their voices and be healthy.
Hi, everyone. My name is Diana Menendez, and my pronouns are she, her, hers. I'm a psychologist, and I'm a counselor at Counseling Services. I've been here for about 4 years now, and during my time here, I've had the pleasure to work closely with first-gen students or students with marginalized identities. And I feel like being in this space and being invited to this space is such an honor and something that I hope that can continue to like be established, right? Because I feel like a lot of the time students don't, it's hard for them to reach out. So we need to kind of take this initiative and kind of come to them. And so being in this space is so valuable. So I'm really grateful to be here. Why is mental health important? Well, I'm a psychologist, right? So of course I believe in mental health, but I mean, mental health just kind of impacts everything about what, who someone is and the struggles that they have and, the direction in which they go and the tools that they can use. And so I feel like supporting initiatives that can create more access, decrease barriers for students and support their mental health, I think are really important. So yeah, thanks for having me.
My name is Noah Dunovich. Pronouns are she, her. I am a third year psychology major, but I'm graduating early. So technically this is my final year at Cal Poly. I am also a peer health educator along with Katie on the mental health real team for Cal Poly Pulse, which has been amazing so far. I think mental health for me, I have just always been interested in how mental health affects everybody in every field and every point in their lives. I've seen it kind of in Cal Poly, I've seen it in high school, in the business world through internships. I think just mental health kind of follows us everywhere, which is what got me really interested in it. And definitely being a member of Pulse has taught me a lot, as well as being a research assistant for Dr. J Garcia's Q Cares team, as well as another research project I'm working on. So yeah, I think mental health just to me appears in every single aspect of our life. So yeah, I'm really honored to be here today, and I'm excited for the conversation.
Well, we're really excited to have everyone here. Before we get into our discussion, I just did want to say that we have a handful of questions, and we're also leaving time at the end for students to ask their questions if they feel like they need to ask anything. But we're going to be going one by one, but that doesn't mean that each panelist has to answer or has the pressure to answer each question. This is really just a discussion and just getting to know more of the resources on campus.
Also really quick, just want to point out, as Natalie said, we're going to have some time at the end for student questions. So attendees, I just wanted to point out this Q&A section. So if at any point throughout the hour something comes up or you want a panelist to elaborate on something, you can go ahead and put it in that little spot. And then for the last few minutes, we can relay those questions and allow the panelists to answer them.
Awesome. Thank you, Natalie and Michelle, and to all the panelists for introducing themselves. You may have answered a part of the first question already, but here we go. The first question is, how has your journey with mental health impacted your life, and what are some ways that you manage your own mental well-being?
I don't mind starting because I also realized that I forgot to answer why mental health is important for me, which is ironic because it's important to me because I have ADHD, and I think that's probably why I forgot to answer the question in the first place. But it's important to me because I have ADHD and I was undiagnosed for all of my college years and all of the time before that. And so it really impacted my experience in college, and it also impacted like how I was building relationships and how I was able to maintain relationships. And it wasn't until I was diagnosed this past fall that I was able to start getting the tools and language and resources I need, and then also be able to have those discussions with friends who might also think that they have undiagnosed ADHD who are experiencing similar struggles, that like the tools I've been able to get could help them as well. And then it's just really important for me, and the impact on my life is that as like a person of color and someone who has been perceived as like a woman of color for a long time. I wasn't diagnosed in the beginning because my doctor didn't believe me the first time I asked 4 years ago. So that's why it's really important for me to discuss it. And that's the impact it's had on my life of being able to, just like we've been talking about, like get resources and share resources and talk about them. And then also be able to have open discussions about what those resources look like, whether it's, stigma around medication or what type of support we get from people or how it affects our relationships and stuff. And so that's the impact, I think the hugest impact mental health has had on my life, and being able to discuss that with my friends who have had similar impacts and stuff.
So I'd say for me, it's funny when I saw that question, when I hear it now, I thought back to my experience as a student at Cal Poly when I was first coming out as queer and then as trans, and just figuring things out and figuring out who to go see to talk about this stuff. And back when I was a student, there were, and still currently now, there are very few people who were doing this work. And so I got the name of one person who was like, there's one person, charges, way too much that I couldn't afford. And so I think about being first gen and like not really getting kind of the whole how to be in college thing right away, and being low income. And so I didn't have health insurance. I didn't have, parental support. I had, 3 jobs on campus at like the Pride Center and the Gender Equity Center, which used to be the Women's Center. Like I had like these random jobs that I was like, oh, look, I put together $100. Like maybe I could go spend an hour with this therapist. And it was more than $100. And so I remember there not being a lot of care. And so the barriers to actually accessing care as like a low income first gen, I'm biracial, Mexican American, and I was like trying to figure out my trans and queer identities. And I was just like, this is not healthy. This is not okay. And I struggled a lot. Fast forward to now as a professor, part of what I didn't mention is that my research line is all about access and barriers to mental health services for queer and trans folks, right? Like, and I don't know that I know that line exists, but when I saw that question, I want to hear you say it now. I'm like, that is such a direct line that, you know, all these different things and all these different paths I've taken with my research, that here I've ended up back in San Luis Obispo. And part of what I've been doing now is with the Slow Acceptance Project, which is training 60 therapists over 9 months to be affirming of sexuality and gender identity. And it's just, yeah, so it's kind of come full circle, right? There weren't enough people then. And so now we're just trying to create lots of opportunities for folks, really talking through intersectionality and what it means to support people of different races, different sexual orientations and gender and socioeconomic, like all of that variety, and making sure that our people are well trained so that there aren't issues about access and barriers, right? There are other barriers that exist culturally and linguistically and all these other things, but at least the training barrier, maybe we can remove that a little bit, right? Give these people some training. So yeah, that's in my journey.
Okay, we can move on to the next question. Thank you for those responses. I think those were very insightful. But going on to the next question, because someone can, even though they're going through the journey, still struggle with talking about mental health or even being self-conscious because of stigma or many other reasons. When did you feel comfortable talking about mental health and what led to that point?
I can take this one. I honestly didn't really feel comfortable talking about mental health until maybe last year, if I'm being like, I don't know, probably even sooner than that. I think I just got a lot of practice talking about it through being an RA, and it becomes easier as you learn more about it, as you take in more information from the people around you, and from, you know, social media has really helped me learn more about myself and the people around me and the struggles that other people are facing. And my classes, I'm a psychology major, that's helped me a lot too. And I definitely want to recognize it's so much harder to talk about your own mental health than mental health in general. And that's something that I'm working on, and I think that everyone can work on and do better at. And yeah, so just basically practice is going to help you feel more comfortable, starting small with conversations with people you trust, and then eventually it'll get easier.
I just want to riff off of what Katie said for a moment, because I feel like that's so true. I was, as she was speaking, I was like, oh, maybe I got comfortable a lot later than I wrote down. I tried to write down notes before, because I would have thought that maybe it was as I was an RA and trying to model like vulnerability and all of that with my residents. But I think really it happened in quarantine. I live with my mom and my sister right now. And just being stuck inside with the same people day in, day out, as much as I love them, you have to be a lot more open, because it creates a lot more, like, at least for me, like when some of my symptoms manifest, it can create more tension if I'm not going to be open and discuss what's happening and like why the dishes didn't get done, or like really small things that can become bigger deals. So I would say it's probably like literally within the last few months that I've become like the most comfortable talking about my mental health, in relation to anxieties and depression and ADHD and all of that. Quarantine has kind of forced that upon me, and it might have done that to other people too.
I think that's a great point, and something else that just made me think of is that for me personally, I've always been kind of pretty open emotionally with people that I'm very close to, my family, my closest friends. So I feel like in that sense, I've always been pretty comfortable talking about mental health. But for me, what's difficult is when there is people you don't know. Maybe you're going for a job interview or people who don't know who you are. And if you were to disclose something about your mental health or about mental health in general, there's kind of that fear of stigma. So I think being a peer health educator now, one of the things that's really important to me is kind of trying to encourage other people that mental health is not something to be scared to share. It's a strength in that you're recognizing that in yourself. So I think that's something that I've kind of learned in the past year or two.
I really appreciate you sharing that, Noah, because I think the context really matters. You know, in some contexts, it's easy to share or disclose fully, and then in others, maybe not so much. And I remember when I was really little having feelings, I think it was anger or something like that. And my mom was talking to me about it. And there was this communication that like, that's not okay, you know, or like, that's too big for this space. And so learning and internalizing, how do I read the community or the culture around me so that I can fit in or make it work or be accepted or things like that. And so I think for my journey of talking about mental health, it's been both through professional roles as well as personal friendships and other relationships that have allowed me to have safer spaces to share more openly, and then also recognizing how to bring that approach to others and how to be a space where other people can share with me, whether it's one-on-one or in groups or in large spaces. So I just think the context really matters for when we're talking about mental health and what that means for folks.
Yeah, I do want to share about that too. Like for me, a turning point, I think it was college. Like I was a psych major all the way to, and then I started learning that things that I felt or things that I had experienced, like there's names for these things and other people have experienced similar things. At some point, I reached out to the counseling center at my university and I did an individual therapy and group therapy. And I was really fortunate that they had like a session limit, but I could access it without like major issues. And I had a really wonderful experience there. And so that really encouraged me and inspired me to go on this path as well. I feel like the more I understood myself and what was going on for me, the more I was able to communicate that with others. But it kind of helped to do it with someone that was neutral, right? It wasn't someone that was too close to the issue or the concerns that were going on. But I think, yeah, I can think back to college as being a really important point for me in terms of mental health, talking about it and encouraging others to do the same too.
All right, awesome. Thank you for sharing that bit of your story. This next question is definitely a focus of why we're all here. Question is, why is working with BIPOC underrepresented students important to you? How is this a priority in your work?
I can start with this one, partly because this is, I think, the work right now is creating spaces where students can be supported and have space to thrive and to belong, like I said earlier. And I think the thing that undergirds it for me is that racism and marginalization is a public health issue. Like there's data to back that up. There is experiences that many of you all and others that you know have experienced. And so I think it's, for me, less about defending the issue and actually more about shifting systems and responding from kind of a practical point of how do I make the counseling services here at Cal Poly more accessible, more connected, more relational, more of a space where you can feel like it's a place to risk trust, you know, to bring out the truth of your experience and to feel like you're met with that. So I think for me, both in my social work training and in my role as director, I'm thinking about the bigger picture systems things. So it's not just about me having a conversation with one person, but is how does the whole access system, how does the bureaucracy of the university fit in? How are these identities intersecting and really mitigating access and that's really a central part of how I see my role and how I want to partner with you all as students and the others on this panel to make real change that's quantifiable and that feels like we're making progress here at Cal Poly. And I applaud all of the efforts that have gone on and that are continuing to go on. And I'm really looking forward to future partnerships too, because this can't be done in isolation. You know, I can't just say, okay, I'm going to change this or I'm going to do this differently, but it has to be in the context of relationship and belonging. And so that's really kind of what I'm thinking about it in terms of my work and how we're prioritizing it here.
Yeah, I think you said that really well. I think like it's impossible to talk about mental health and mental illness without addressing social justice and inequality. A lot of, if not the majority of cases, have some root in our culture, and like those same issues just perpetuate the problems because they prevent people from accessing the resources and care that they need, along with creating the problem in the first place. My goal as a peer educator at Pulse is to be that bridge for students to the resources that they're unaware of or that they need help accessing. We partner with groups like the Multicultural Center, like this event tonight, to help make resources more available to students. And we also recognize that individuals with different backgrounds have different levels of comfort when discussing mental health. So it's our goal to create a safe space for people to discuss mental health and learn about it in general. It's also, like Andrea just described, it's an area that we're actively working on at Pulse. I think you can always do better. And really all of campus health and well-being is working on it to improve.
I mean, I think I'll just echo a little bit about kind of what they're saying. And, you know, we know that prejudice and discrimination and racism and experiences like that are part of the minority stress model. And this model is this idea that, you know, folks who have minoritized identities might experience more mental health concerns, but it's not that like, oh, being queer makes you, you know, somehow more mentally ill, or like being a person of color directly leads to being more mentally ill or having more things come up. It's through the mechanism of discrimination, racism, victimization, isolation, right? Vigilance, right? Even if you haven't been personally attacked or have, you know, things said against you or microaggressions, just knowing that people in your community have, right? And so I think if we look at those lenses of, you know, who's accessing care, who feels comfortable accessing care, when is mental health care culturally and linguistically appropriate and like well done, right? Those are all pieces of the puzzle. And so I think to not focus on people's experiences with minoritized identities is to just miss out on so much, right? On so much richness, so much potential for so much growth and so much change. To be seen and to be heard when you say, I've experienced these things in my life, or people in my family have experienced, or my friends have experienced, my community is hurting, and to be seen and to be heard and for someone to bear witness to that and validate it, it is such a powerful experience, right? And so I think those are the pieces that for me are such shifting points, right? To have someone in my office and we're talking through these things and to say, I haven't walked in your shoes. I don't know that experience, but I hear you. I believe you. I'm validating that that sounds really traumatic and hard. Like those are the moments that I think we, you know, make such amazing connections and like little shifts of change, right? That are just so, so powerful.
Yeah, I mean, definitely echoing what panelists are saying here. Feel like the BIPOC and underrepresented students definitely face higher rates, right, of violence, discrimination, poverty, so that all impacting access and ability to reach out for support, and especially in the current political climate, where there's that real threat to their well-being, to the well-being of their loved ones, that creating just more stress, more trauma, intergenerational trauma that just keeps, going and going and strengthening. So it is like a real crisis, and it is, it's this moment that it's really important to kind of mobilize resources and be available to support students.
And I think that's a good segue into our next question. And what role do you play in supporting students' mental health?
I think Katie kind of touched earlier on kind of what Pulse does as one of the mental health teams on campus and what we do. But what I think personally my goal as an educator is to make sure as a student that I'm encouraging the students around me to be advocates for mental health in every single thing they do. And that means being an upstander when you see something's not going right, and not necessarily regarding bullying or discrimination, but also just starting those mental health conversations when you see an opening for it. I think that's extremely important to make the whole community and environment at Cal Poly more affirming to people of all different backgrounds and experiences. So I think as a peer health educator, that's kind of what I try to do, is just spread awareness in my circles as well as others.
And Counseling Services is the on-campus provider of mental health care and support, both in terms of direct service as well as outreach. So outreach is really our way of getting outside of our offices and outside of our buildings, and when we're not on Zoom, being in spaces where you all already are, to connect with you. And so one of the programs we have related to that is called Let's Talk. And it's a consultative conversation with a counselor where you don't have to fill out paperwork or share all of your history, but it's really a space to talk about whatever's on your mind, and to get a feel for what it's like to talk to somebody else about it, and then maybe get a referral to a clinical service or maybe to another support space on campus. And so I just want to use this opportunity to invite you all to participate in that and to seek out more information about that. But we are really seeking to provide services that are kind of traditional counseling, as well as more informal, conversational, or kind of get your toe wet sort of ways of getting connected to services here.
Yeah, and adding on to what Andrea started saying, you can find that information on the SDAB calendar too, for the dates and the times in which Let's Talk Anything and Everything is happening. Currently, it's on Fridays at 11. Counseling Services also offers a specialized Let's Talk. It's called UndocuTalk, and it's specific for undocumented students and students from mixed status families. So that is another service that we offer. It is also on the SDAB calendar.
One of the things that came up before that Andrea mentioned was this kind of systemic pieces of what we're talking about, right? We can talk about individual therapy, individual counseling, even groups, but like the systems that we're in, if we're not also focused on those, then I think we're often missing out a huge part of the puzzle, right? And so part of what we're doing and part of what's happening on campus is that there's assessments all the time that are happening, there's recommendations all the time. But right now we're really focusing on diversity, equity, and inclusion across all the health services. So the health center, the counseling center, wellness services, and really taking a look at asking students, right, from these different communities, from looking at disability, looking at undocumented students, looking at queer and trans students and BIPOC students, right? What are people's experiences like? What are their access points, and what feels like, hey, I can get access here, and what feels like, hold on, there's a barrier here, and how do we actually shift and change some of what we're doing on campus to better serve the needs of these different communities? And so that's one thing kind of from a systems level that that we're taking a look at, and that, you know, we do these assessments kind of all the time, but it's just this continuous cycle of what are we doing? How are we doing it? How do we make it better? And so that's something that that's going to be happening and is happening this year. And so as we reach out to different student organizations and different student groups for focus groups, consider participating, right? To share your voice and let us know what your experiences have been like, the positive, the negative, like, have you accessed these services? And if you have, awesome. If you haven't, why not? Right? Those are the kinds of things that we're going to be looking at.
Okay, thank you. I feel like that leads us, that puts us at a perfect spot for the next question. But earlier you shared the moment you began to feel comfortable talking about mental health. This question is, what advice would you give to students who are afraid to seek that support still?
I guess I'll start. I would say the first piece of advice is, you know, think through the people in your lives that you would be most comfortable, you know, taking that first step of bringing it up to, whether it's, you know, just a baseline conversation of I'm not doing well, or whether it's talking to like a mentor in your life that could offer those resources. Like I think back to my time as an RA and the students that would that I felt fortunate would feel comfortable coming to me to ask for those resources. You know, it's just locating those people that could either have the resources and share them with you that you feel comfortable talking to, or feeling comfortable talking to a friend that could kind of like hype you up to go get those resources or to go find those resources in another place. Since, you know, not all of our friends are psychologists or anything like that, but they could help support you in finding the people that do have those resources and all of that. So I would say going one of those routes could be a really helpful way to do it. But yeah, I think it's always really helpful to thinking of like RAs or mentors or stuff like that, because those could be like a distanced perspective in a way. So it doesn't feel maybe as nerve-wracking as like this, you know, if I tell this person that I'm not doing well, they're not gonna approach it right, because now you know you're going to someone who has resources. But yeah.
I think I would start with just normalizing their experience, that, you know, it makes sense that these are hard things to talk about, or saying, you know, you may not feel comfortable right now, but think about who you might want to talk to, some of that preparatory action of, okay, you don't have to do it yet, but if I were to talk to somebody, what would I say to them? And so then you can do a little bit of that role playing inside. And then I often will refer people to Frozen 2 and the advice to just take the next right, or do the next right thing, do that one next thing. You don't have to figure it all out or get to the end or resolve your concerns or your problems, but taking the next right step will then get you in a next position to then take the next right step and the next right step. So really thinking about one thing at a time rather than being overwhelmed by all the things. And I think that can be helpful to not feel responsible for recovery in the first moment, but to say, okay, I did this thing. And then you can feel great about doing that thing and celebrating the accomplishment of doing one thing. And that goes a long way in that self-belief and that ability to continue on that journey of more steps in the future.
Yeah, kind of going off that idea of taking steps, I think it's important to acknowledge that, like, if you're already seeking support or thinking about seeking support, you've already done one of the most difficult things, which is acknowledging that you're having these feelings and that you need support. So good job if you're already there. And yeah, from there, just take it step by step. Find someone you trust first. Work with someone like Pulse or your RA or a professor or even just a friend to help find the next step that you should take.
guess what I would like to say is that affirm that it's okay to need help and that it's okay to ask for the help that they need. Also to let them know that there's many people on this campus at counseling services that are genuinely committed to supporting your well-being, that are invested in listening, understanding, and honoring your experiences, and doing the personal work that it takes to be effective in doing those things. So I would just like to affirm and highlight those pieces.
I think the other piece is, if someone has gone through those steps of either talking to a friend or a loved one, or, reaching out for professional support from a therapist or a counselor, I think once they get to that stage, or if they're able to get to that stage, then I think the other piece is like, I don't think this is something I knew, like that you could actually like try different therapists out, right? Like if it's not a good fit, I often tell my clients to give it 2 or 3 sessions, right? If the first session is really, really bad, then maybe you don't go back, right? But like usually if you could give it 2 or 3 sessions, warm up to the idea, they're getting to know you, you're getting to know them, you're kind of seeing their style, right? If you start to vibe, great, stick with it, right? And if you don't, try someone else, right? Like that's okay. Not everyone's going to be the right fit for everyone, right? And so my style might be perfect for some people and totally not right for other folks. And so I think it's okay, right, to try different things on, to see what feels good, to see what fits, and to also challenge yourself to stick with it beyond, that first session or two, to see if maybe it could get better, right? And that the person on the other end is there to support you and help you. And if it's not a good fit, they're also going to want you to find someone else who's a better fit, especially when we're talking about minoritized folks and, who understands your cultural background, who understands, right? And doesn't mean that they've had to walk in your shoes or they've had exactly the same experience, right? Because that's not going to happen. But like someone who understands and who can walk you through some of those things, and who you can feel a little bit more open with over time. And it just takes time also. So yeah, balancing that.
That's a great advice. Everyone had something to say about that. Thank you. And that kind of goes into the next question, because maybe someone has sought that support and they want to move on to maybe talking to other people about it and about their experience. What advice or what would you recommend to a person of color or to underrepresented students in the way that they want to talk about their mental health to loved ones if that loved one still has stigma about mental health?
I think sometimes when you're talking to someone who has a stigma or who thinks of a stigma revolving around mental health, I think what can be helpful is describing the experience that you're going through or describing the feeling rather than using maybe terms and words that could seem frightening to people who still have that stigma around mental health. So what I would suggest is kind of digging deep and describing what you're really feeling to your loved one. And I'm sure that in some capacity, that loved one would be able to relate, because at the end of the day, we've all felt down sometimes. Of course, there's a huge spectrum of how you're feeling that and in what ways people feel those things. But I would suggest kind of describing the experience and the feeling. And that way your loved one will be able to take part in relating to that feeling in some way. And then they would be more open to hearing about kind of what support you need. I also know that I'm actually Israeli, so I'm bicultural, I guess you could say. So I know that every culture has a different approach to things, and I think going from the approach that your loved one takes would really help to have them understand what you're feeling as well.
I like that. Noah, thanks for sharing those ideas. I'll add to that and say, I think making a plan for yourself for after the conversation as well. So knowing that what you share may be dismissed or challenged or pushed aside or may increase some of the feelings of concern or just sadness that you're experiencing already, have a plan to reach out to somebody who you know will offer support to you, whether it's planning a therapy appointment for after that, planning coffee with a friend, or just planning to reach out to somebody who really gets you. That can be really helpful to have kind of an antidote to what might not be a supportive or empathic experience for you.
I would also say to consider maybe your intention with the disclosure of the conversation, and if there's an ask from the other person, like, are you looking for more emotional support, or do you just want the other person to know and understand a little bit more about what you're going through, or is there like a specific request about supporting treatment in some ways? So thinking about what do you want to get out of that conversation, and also thinking about you choose who to say something to you, you choose how much to disclose, so those things are in your hands.
Going off of that, I would say my own personal experiences with like disclosure or opening those discussions like in my household. There's a lot of stigma around ADHD, and there's a lot of stigma around like being medicated with ADHD and all of that. And that's been something I've had to work through a lot through the past few months. And I think something that's been really helpful for me is not just like the sit down conversations of it, but finding new ways to relay like information about how I'm feeling if I feel like I'm not wording it in a way that's being understood clearly. So I feel very Gen Z in saying this, but there are a lot of like TikToks that have been really helpful that I've like sent to my mom or I've shared with my sister, like Instagram infographics, even though those can be like fraught pieces and stuff, those have been really helpful. But I think finding like new aids to help share that information or share those experiences that kind of draw on like visual learning or not just the discussions, I think that's been really helpful for me and could be helpful for others too.
Awesome. We have about 8 minutes left. We do have one more question, but we're hoping to open it up for students if they have questions. I know that there is one in the chat. It says, are there any efforts being put forth to train or educate faculty/staff in mental health in a multicultural context, and about how to address these topics in classes with students? If anyone wants to answer that one.
I'll start. As I'm new here and getting to know what exists and what resources are available, that is at the top of my list in terms of resourcing faculty and staff to be able to be both culturally responsive as well as mental health aware, and using some of our trauma-informed lenses as well to be able to respond effectively and supportively to students from their faculty roles or their staff roles. And so that's something that we are talking about internally here at Counseling Services, and looking forward to partnering across campus to move some of that training forward, because I know there have been lots of pockets of good stuff going on, but not always a lot of continuation or collaboration across units. And that's something that I'm really excited about opening back up again and seeing where the partnerships are that we can continue forward. And I really appreciate, Jay, you sharing about your work with campus health and well-being, because that is an effort here as well to continue our work around becoming more and more aware of our own biases, what students across identity need, and how we can really be responsive to those needs and make spaces where students feel safe and feel like they have access and can be successful as students. So I think those are two key partnerships that we're working on from my perspective.
Thank you for that, Andrea. We have one more question slash suggestion in the chat. So it says, this isn't really a question, but more of a suggestion, maybe for Andrea, but not the pressure's not just on you. Have you thought of having a Zoom panel webinar with all the Cal Poly counseling staff? I know that taking the first step to meeting with a counselor at Cal Poly can be really scary for students, so it might be nice to give students a chance to ask questions anonymously about what they might expect and how the services work, as well as to meet the counseling staff. When I go on the counseling website now, it is pretty intimidating seeing a bunch of names and having no idea who is really behind those names. So it would be nice to have a chance to hear counselors and put faces to names.
Agreed. Yes. Thank you for that suggestion and that feedback about the website. We're in the middle of redoing our whole website right now. And actually today I was reviewing options of how we can showcase our counselors more effectively from that page, sharing a little bit about who they are, and then going into the longer bio that I know can be intimidating to start with. So I think that's an interesting idea about having a panel of counselors, and we are thinking through how we can be more open and accessible to be known about and to share who we are. So I think that's an interesting idea and maybe one that we can explore a little bit further. We are currently developing some videos and some other ways of seeing us a little bit more and getting a feel for what our services are like. So if you have more ideas about that, feel free to email me either directly, personally, or we also have a counseling email address that is just counseling@calpoly.edu. And so if you email that, you can find out more about our services. You can ask any question you want to. I'm the one who gets those emails. And so I will either share it with somebody else to respond, or I'll give you information. And so I really want it to feel like you're welcome to ask questions and to not know things. We don't expect you to know all the answers. That's why we're here, to help you navigate and to come alongside. So reach out to me if you have more to share about that, but we are looking forward to making our web presence a little more accessible and friendly, and then also some other ways of sharing who we are with the campus.
Awesome. Thank you so much. I definitely think like those sound like good ideas, especially with the virtual world that we're in, not even being able to walk into the health center and counseling services and talk to someone to make an appointment can also make it feel pretty intimidating. So that's good to hear. Thank you.
Okay, I don't see any more questions in the Q&A. But again, if anyone does, you can go ahead and ask that. But I guess as a final closing question, discussion topic, if anyone wants to share any resources that you know of that students can use to support their mental health, I guess this right now is a space to do that.
I just want to remind everyone of the Let's Talk Anything and Everything services that we have through counseling, and also the UndocuTalk. I also want to mention that we have a support group called Roots, and Roots stands for Reclaiming Our Origins Through Self-Exploration, and it's a support group designed for BIPOC identified students, where they can come in and share stories, about resilience, right, and strength that exists in diversity, and also the struggles, right, that come with that. So to kind of build community and feel heard and seen. And so if you're interested in that, give us a call or email me. My email is dmenende@calpoly.edu. It's also on the website, but you can also just call counseling services and ask for it. But that is another resource that is available right now too.
One of the resources that I'd like to highlight are the coaches at Pulse. They're people that can help get you started on your mental health journey. You can get a private consultation with them, I believe, through the mental health or the campus health and wellbeing website. If you go to the wellbeing services page and then to Pulse, you should be able to book an appointment with a Pulse coach. And I also wanted to just comment and kind of echo this idea that Dr. Garcia had. you know, self-care and mental health care isn't one size fits all. So it might take a little bit of time for you to figure out what's going to work for you. But don't be disheartened if you discover that, you know, something that your roommate suggested isn't working for you. Just keep looking and try, and you'll find it eventually.
Before it's too late, I wanted to let everyone know that I dropped an assessment form in the chat, so that will help give feedback for future events. I also dropped the Zoom ID for the student debrief that's happening directly after this panel.
Thank you so much to all of our panelists for being here today and all this valuable information. We really appreciate it.
Thanks for putting it together and for having us. Thank you.
Thank you. It was awesome.
Discussion.